two-person stand pivot transfer. This is my patient, Wendy, and this is my assistant, Sheila. She will just be helping me transfer Wendy over to the wheelchair. Before you start, you want to make sure your environment is set up and free of barriers. You want to make sure that your wheelchair wheels are locked. And you also want to make sure that the wheels of the wheelchair are out of the way, because if they're in like this, you might accidentally trip over them. You also want to make sure that the leg or the footrest on the wheelchair is not in the way either. I already took them off, and I will put them back on once I get Wendy back into the wheelchair. So then you want to make sure that your patient has shoes on, and then you want to make sure she has a gait belt as well. So I am going to be the lead therapist and transferring her over, and then Wendy, as we move you, I'm going to be giving you a couple instructions. I would just like you to follow those, and then I'm going to make sure to communicate with you and tell you when we're ready to get up and go, okay? So first, you want to make sure that you lock your knees into your patients. You want to brace them, or brace your patient's knees to keep them steady. And then, first actually, I'm going to have you scoot forward just a little bit. Okay, and then now your feet are perfectly straight on the floor, flat on the floor. So then you want to brace your patient's knees. And then Wendy, I am going to have you lean forward, and you just want to look over and make sure your toes are over, or your nose is over your toes, okay? And then on the count of 3, I want you to push up from the armchairs, or from the armrest on the chair, okay? On the count of 3, we're going to lift her up, okay, Sheila? 1, 2, 3. All right. And once you get them up, you just want to make sure they can stand and catch their breath really quick. And then once you have the patient steady, we're gonna on the count of 3, we're gonna turn again, but I want you to use your good leg and take a step, and then we'll just kind of drag your other leg with it, okay? Okay. So 1, 2, 3. Okay, can you back up until you feel the wheelchair on your legs? Okay, do it. Okay, and then can you reach back and grab for the armchairs on the wheelchair? There you go. And then once your patient is seated and safe, you can go ahead and put the footrest back on the wheelchair, and then you're good to go. And that is how you perform a two-person stand pivot transfer.